Okay.
Over and over again, it works. And the belly button, natural looking belly button, an innie, not an outie.
Okay.
You gotta get an innie.
So how does this woman's life change? What does she tell you?
Oh my God, you should see her. She's just full of joy. She's just full of life. She came to my office and she just cried, gave me lots of hugs, and we have become very good friends since then.
Now, does this give her, as you say, the leverage to start taking care of herself better?
She already has. I see her at the gyms regularly. I know she's eating well because we keep in touch. So this is a good example of what Lipotuck can do for you. Jumpstart. Let me take care of the body. Let me tell you what I can do surgically for you, and you run and do the rest of it through nutrition and diet and exercise.
Okay, good. Another quick break and we'll be right back. More photos. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about the Lipotuck procedure. If you're unhappy with your abdomen, my advice, stick around for this next segment. We've got dramatic photos coming up. We'll be right back.
I've never really had a waist. I always carried a lot of weight around my middle, and had a stomach. I wanted to get rid of that. I was a 10-12 and now I'm a 4-6. Oh, I would say don't do it unless you're going to have Dr. Ahmadi do it. He knows what he's doing, and I just feel like he's the best. He's very, very professional. He's very meticulous. He is very kind. And I just think Dr. Ahmadi is a wonderful doctor.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are here with board-certified plastic surgeon, Dr. Ahmadi, and we're talking about the Lipotuck, combination liposuction and tummy tuck. Okay, Dr. Ahmadi, what are we looking at here?
Very young lady, has never been pregnant, just overweight. And we all know how you get there. You just stop exercising, you start eating the junk food, and that's what your body ends up.
Huge overhang.
Huge overhang.
What is this right here? It's like
even above the belly. You know, its skin starts hanging below the belly button first, then it starts doing the same above the belly button. And then you can also see her upper flank areas. These are not her arms. These are actually rolls of skin and fatty tissue that had to be addressed. Again,
so you're able to remove that fold.
It has to be part of the procedure. It's a one-stop shopping for this look.
Lipo and
Lipotuck.
tummy tuck, obviously on this one.
Yes, absolutely.
So what did you do? How much skin did you have to remove? Or did you have to remove any skin?
Removed skin pretty much all the way from above the belly button, a lot more on this lady, a lot more, all the way down to where the blue line is. And
okay, so I understand. You removed that whole area.
That's correct.
And then you
pulled it together.
Okay.
And then started doing the unthinkable, liposuction the area.
The unthinkable.
The unthinkable.
Why do you call it the unthinkable?
Because that's what I've always been told. Cannot liposuction that flap too much. And very aggressive liposuction for those plastic surgeons who are...
Miserable? Was she miserable like this?
No, absolutely not.
No, I mean miserable before.
Before, they were about to go through a divorce and a breakup.
Is that right?
Yeah.
Okay, so you did the liposuction.
Life changed. Look at the after picture. Look at the waistline, going from positive curves. She's got positive curves now. You can barely see the scar.
What do you mean positive curves?
That hourglass look, the curves, those pleasing curves, that sexy look. That's
this is very sexy. I mean, this is...
I think so.
I mean, to look at the before, if we could go to the before for a second, and when you look at that before, you would not guess that this woman, and how many weeks later?
She is about 3 months out now.
3 months out?
Correct.
In that photo?
In that photo, and a lot of skin was removed, a lot of skin, and a lot of liposuction was performed. And
she gets a second chance.
She got a second chance in marriage, all worked out fine.
And it bothered her though, I guess, which is the most important thing.
Correct, yes. But again, what you want to look at is how flat the upper abdomen is, how natural the lower abdomen is. It's not pulled too tight.
Now the thing right here, there was a little fold right there. That's gone.
That's gone.
You lipoed way up into the back?
All the way up to the armpits, and all the way around to the back, and all the way down to the upper thigh. You have to address the trunk in one shot.
You did the unthinkable. Like you say, other surgeons would say, and your training, your formal training, that said you can't do this.
I've been always told that, and I had to break the rules.
You had to break the rules.
I had to break the rules.
To get a great result. Okay, we have time for a few more photos.
Okay, let's look at this one together now. does not have the same problems as the other pictures that we saw. She's got more fatty tissue and less of a skin problem.
So with this pot belly, this is a younger patient. How old?
She's about 40.
Oh, okay.
She's had a couple of children.
Decent skin tone, good skin tone.
Very skin, yeah, you can hardly see any stretch marks on that picture. That's because probably she didn't get too much weight during her pregnancy.
Would a surgeon look at that and say, she doesn't need a tummy tuck, she just needs lipo?
Commonly made mistake. You would liposuction this lady, skin will start hanging in the middle and especially towards the flank. And if you really want to know how to go about that, just have them sit down in front of you after they've done liposuction from.
And they get.
And you can see the skin just fold right on itself.
By the way, does this work for men and women?
It does. It
Okay.
does. It works great for men too.
With the big overhang.
With the big overhangs. However, you have to be careful with men because a lot of men have what we call intestinal fat.
Okay.
Inside is fat.
For those hard stomachs.
Exactly.
Right.
That's what the term.
Okay.
The term
So they may not be.
some,
They may not be great candidates, but for the ones with fatty overhang, that's good.
it will work.
Okay.
It will
So
work.
back to this woman again.
So I had to think differently about it. She would at most get a mini tummy tuck, and maybe a little bit of liposuction. But what I gave her was a more aggressive tummy tuck and a very, very aggressive liposuction.
Really? Okay.
So again, I started doing liposuction on the sides first, because that's the area that I would like to address first during the surgery. You've got to get the sides trimmed down, otherwise it will not look good. Then you move on to the upper abdomen, liposuction it aggressively, and then remove the extra skin.
Now, when I look at this before and after side by side, it's subtle. I mean, it's drastic, but it's also very subtle.
It is.
She doesn't look done, because I've seen some tummy tucks out there interviewing surgeons over the years.
And
some of them, that belly button is flat as a board.
They're just sticking in your face. You're going, oh my God, what happened?
This is natural. In fact, if I saw her in a bathing suit, and I feel like I have a good eye for this now that I've looked at a lot of before and after pictures, who would know she had anything done?
Well, if she covers it up, if she covers up with the skull.
I don't see any incisions on her. And she had a tummy tuck.
The incision is there. You just have to look for it.
So this is an athletic look as well.
It's a very natural look. The idea is not to overdo it. You want to do just enough amount of liposuction to get those positive curves that we're talking about going. Flatten the upper abdomen, remove enough skin, but not too much, so that it's not too tight below the belly button and the pubic area. If you look at a female's body, it's a lot flatter on top above the belly button than it is below the belly button. They got more waist than the man, but the flanks are a lot more curvy than ours. A man's body is completely different. It's very angular. It's very straight. Women have more curves. You have to recreate those curves.
So what do you say to the person watching this? They think maybe they're too far gone. They already went to a surgeon and said, I don't know, you might have to lose 50 pounds first.
I would say, come on over, let me take a look at you. I'll be very honest with you. If I think that you're not a candidate for it and you're not going to have good results, you'll hear it from me.
Because you make it sound like you're going to lipo anybody. So you do turn some people away.
I have turned people away.
Okay.
Mostly people whom I don't think will end up giving me back what I want from them, which is diet and exercise. Remember, it's a contract between us. I will do this for you, but you will have to give me back the diet and exercise. That's the key. That's what all these patients need, just a jump start to get them started, and then the rest of it is up to them. But I don't want to let them go. I want to keep I do keep in touch with them, and we're building a support group for each other, for these ladies, so that they can talk, they can share their stories, and those skeptical people are more than welcome to listen to them and join them and talk with them over the phone or even visit them. All these people are happy to tell the stories to the skeptics out there.
Dr. Ahmadi, thanks for coming on the show. Great stuff, and very interesting. Thanks.
Thank you for having me, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like to see this interview online, live, you could visit our website at wellnesshour.com. For now, I wish you good health.